Welcome to Radi Us, our University of Manitoba Radi Faculty of Health Sciences monthly podcast, where you get to catch up on the headlines from the past month and meet our faculty, staff, and learners making news. We'll also be engaging with our Radi community beyond our UM campuses, so be sure to listen for alumni and partner voices too. The Roundup covering the month of June 2026 includes stories about graduate student research events, pulmonary rehabilitation with smart technology, summer convocation, and more. I'm your host, Jonathan Wilson, from the Communications and Marketing team. The feelings of joy were the same at this year's UM Spring Convocation ceremony, but the setting was different. Instead of Bannatyne campus, convocation was held on the Fort Garry campus on June 1st, where degrees were awarded to graduates from dentistry, dental hygiene, medicine, nursing, and pharmacy, as well as master's and PhD students from the Radi Faculty of Health Sciences. A larger space for the ceremony was needed because of the increase in students in many of the programs. One joyful student was Dr. Tristan Rohatinsky, a member of the Max Rady College of Medicine class of 2026 who is entering her pediatrics residency at UM. Rohatinsky said medical school was a transformative and meaningful journey.
I can think of several moments that were really memorable, but one thing that really stands out for me is all the connections I made with people along the way, whether that be my wonderful classmates, the lifelong friendships, the mentors I've learned from, or all the patients I've had the opportunity to meet and care for. All these relationships were really invaluable for me and shaped me as much as everything that I've learned in the classroom and on the wards.
Dr. Sandra Imazanobe graduated from the Dr. Jelznick College of Dentistry's International Dentist Degree Program. The program provides internationally trained dentists the opportunity to gain the credentials needed to practice in Canada. Imazanobe completed dental school in Nigeria and gave herself 5 years from the time she immigrated to Canada to begin work as a dentist. Her plan worked out perfectly.
When you set a goal for yourself and you take the necessary steps to achieve it, you can achieve it. So for me, moving forward, I already started setting my 5-year goal from now on, what I want to achieve for the next 5 years. And I think it's a good way to plan life in general.
Graduate Cadence Morgado Thomas grew up in Winnipeg and has family roots in Norway House Cree Nation. She said she's seen family members struggle with addiction, which motivated her to make positive changes and become a role model for the younger generations in her life. She told CJOB she is now working at an emergency position at HSC under a designation that recognizes the importance of having someone with lived experience to support and connect with Indigenous patients entering the healthcare system.
And I think that's important, having firsthand experience and being with other Indigenous people who have lots of lack of trust in the healthcare system. So I think it'll be important for me to work in there.
Ahead of convocation, College of Pharmacy graduate Gloria Lee has already started working as a hospital pharmacy intern at Bethesda Hospital in Steinbach. Lee hopes to eventually work in Indigenous communities, including Grassy Narrows First Nation, where experiences she had helped inspire her path into healthcare. She recently spoke with 680 CJOB.
Yeah, we're really excited to be able to work with patients. And I always had a heart for rural health. So my plan was I'll start in Steinbach, and there's not a lot of opportunity for pharmacists to work on reserves, and hopefully something will expand in the future with primary care coming in.
Among the graduate students was College of Community and Global Health PhD graduate Maria Baranowski, whose research was inspired by her son, who has Down syndrome. Baranowski's study found that children with Down syndrome in Manitoba are not attaining optimal nutrition, highlighting the need for more personalized and proactive care. She told CBC Manitoba why the study is important.
Absolutely. So my project aimed to determine the nutrition-related health of children with Down syndrome between the ages of 6 and 12 years old living in Manitoba, and to explore their experiences receiving nutrition knowledge and care. The reason I was starting at collecting baseline data is because I was disheartened to learn that there really is no data surveillance right now in Canada of the nutrition-related health of Canadians with Down syndrome. There are also no specific clinical practice guidelines currently to provide meaningful nutrition knowledge and care to Canadians with Down syndrome.
Over 200 students from across Manitoba gathered at the Bannatyne campus on June 16th and 17th for the Rady Faculty of Health Sciences annual Manitoba Student Health Research Forum. The event included a student poster competition featuring 214 research posters, 2 memorial lectures, networking events, a professional development workshop, and a panel discussion on artificial intelligence in research. Roughly 90% of the posters in competition were from graduate students at the Rady faculty, with representation from all 6 colleges. Samuel Ogunzola, a PhD candidate in physiology at the Max Rady College of Medicine, received 2 awards, a Manitoba Medical Service Foundation Poster Award and a Dr. Ed Kroger Travel Award, which supports travel for outstanding PhD students to attend the International Congress on Academic Medicine in Montreal in 2027. Ogunzola conducts research under the supervision of Dr. Jiong Zi, a professor of physiology and pathophysiology at U of M. His research focuses on RNA splicing, a critical cellular process.
So what drew me actually is, I would say number 1 is passion, and number 2 is when I came to the lab, I saw that we do a lot of interesting research. So I really love the fact that my research, directly impact people. Try to understand why disease happen. So it's very, very interesting to me.
Lee Solomon from the College of Rehabilitation Sciences won the Dr. Farouk Kadem Memorial Award at the MSc level. The award is given by the Health Sciences Graduate Students Association each year to both a PhD and MSc student. Solomon also won an award earlier in the month at the College of Rehabilitation Sciences Graduate Student Research Day on June 2nd. At both events, Solomon presented a qualitative study on the experiences of respiratory therapists doing terminal extubation or the discontinuation of mechanical ventilation during the pandemic.
It was a great way to end my graduate student journey. This is my last event at MSHRF as a student because I'll be finishing in the fall. And it feels very rewarding, and I feel very lucky to be honored by the community that supported my journey for all these years.
A UM researcher is currently developing a first-of-its-kind immersive virtual reality breathing exercise program tailored to people with chronic lung disease. Dr. Diana Sanchez Ramirez, Associate Professor of Respiratory Therapy at the College of Rehabilitation Sciences, is developing the program, which includes a virtual application with integrated biofeedback for use on wireless headsets alongside a smart ring to monitor the user's vital signs. The program is being designed so that users can do the breathing exercises from anywhere, including their own home, rather than having to travel to a clinic. For the last few months, Sanchez Ramirez has been working with a research team that includes a patient partner who is giving feedback on the usability of the technology. The next phase will bring in up to 32 participants to pilot the program in both lab and home settings. Terry Greenwood is the patient partner who has been working with the team. He has never used VR technology before, but said the team made it easy for him.
I'm just, I'm in awe of people like Diana and all the people, because there's people that are working on this, trying to find ways to help people, and I just think that's wonderful.
The Rady faculty celebrated National Indigenous Peoples Day with a sacred fire and pipe ceremony at the Mishkiki Gitagan Medicine Garden, followed by music, dance, and Indigenous vendors at the Brody Center. The event was emceed by Deborah Beach Ducharme, Director of Indigenous Health Integration with Ongamazin Education.
So today we're celebrating our people once again, but now we live in the urban center. And there's much to celebrate and be grateful for. So now, when we first moved here in the 1960s, there were very, very few Indigenous people living here, and now we make up 20% of the population. And more of our people continue to get educated here at the University of Manitoba. In fact, the University of Manitoba is known as being leaders when it comes to Indigenous education and Indigenous health. We're very progressive when we go out to recruit young people to attend this university. And so I'm very proud of that.
The College of Nursing held its first ever Indigenous Peoples Day ceremony on the same day in the atrium of the Helen Glass Center of Nursing on the Fort Garry campus. World-renowned physician-scientist and health sciences education leader Dr. Peter Nickerson has been appointed an Officer of the Order of Canada. Nickerson is a Distinguished Professor, Vice Provost, Health Sciences, and Dean of the Max Rady College of Medicine and the Rady Faculty of Health Sciences. He was among more than 50 Canadians who were newly appointed to the Order of Canada on June 26th. Nickerson, a 1986 alumnus in medicine, is internationally recognized for groundbreaking research that has significantly improved patients' access to life-prolonging kidney transplants and reduced their risk of organ rejection. He was instrumental in establishing Canada's national network for kidney donation and transplantation. In his 4 years as Dean of the Max Rady College of Medicine and Rady Faculty of Health Sciences, he has led the expansion of several programs including medicine, nursing, and respiratory therapy. He also helped establish the new College of Community and Global Health and the School of Biomedical Sciences. The University of Manitoba's Rady Faculty of Health Sciences hosted its first simulation retreat on May 15th, bringing together about 100 participants from and Manitoba health organizations. The event featured hands-on demonstrations of simulation technologies, including high-fidelity mannequins and Radyverse virtual reality training tools. Faculty members and partners such as RRC Polytech, STARS, and the Winnipeg Fire Paramedic Service shared how simulation is being used in education and healthcare. Rady Faculty's Vice Dean Education, Lynette Saragusa, said these tools are helping shape the future of healthcare training.
The future of healthcare is not going to be built on algorithms and tech alone. It's going to be built by people in rooms like this, where we are figuring out how to blend the best of human teaching with the best of what technology can offer.
Thanks for joining us today. Radius is heard monthly on UMFM 101.5, and all episodes are available for stream on Spotify, Apple Podcasts, and YouTube. Please send us any ideas and feedback to radymarketing@umanitoba.ca. Read more about this episode's stories by reading the show notes or visiting our new UM Today news site at umtoday.ca.